red carpets of late 2022 and early 2023 did not just shimmer with sequins and silk. They whispered with a sudden, collective physical erasure. A hush fell over the industry as A-list actors, high-profile moguls, and reality television stars arrived at events looking visibly transformed, not through the slow, disciplined grind of personal training, but through a rapid, almost surgical shedding of mass. The transformations were drastic, occurring over mere months, and the usual explanations, macrobiotic diets, Pilates, stress, failed to account for the sheer speed and uniformity of the results. It was a visual phenomenon that sparked a fanatical, clandestine whisper network among the elite, a mystery that demanded a solution. The culprit, it turned out, was not a new fitness philosophy, but a medication originally engineered for the management of type 2 diabetes that had breached the velvet ropes of Hollywood to become the weight loss du jour. The drug at the center of this cultural storm is semaglutide, marketed under the brand name Ozempic. Developed by the Danish pharmaceutical giant Novo Nordisk, the medication was designed to regulate blood sugar levels in diabetic patients by mimicking a naturally occurring hormone called GLP-1, glucagon-like peptide 1. This hormone signals the pancreas to release insulin and, crucially, signals the brain to feel full. The clinical trial data for diabetes management showed a notable side effect. Patients were losing significant amounts of weight. This unintended consequence quickly became the primary marketing driver for a demographic far removed from the original patient base. The mechanism is insidiously effective. It slows down gastric emptying, keeping food in the stomach longer, and acts directly on the hypothalamus to mute the food noise, the constant, nagging mental chatter that drives cravings and the desire to eat. Sharon Osbourne, a figure rarely associated with withholding her opinion, became one of the first to publicly admit to utilizing the drug for weight reduction. During an appearance on The Talk, she disclosed that she had lost 42 pounds after injecting herself weekly. Her description of the process was chilling in its simplicity. The weight, she noted, simply drops off without the need for drastic lifestyle changes. She described the experience as effortless, a word that strikes fear into the hearts of nutritionists and personal trainers who rely on the premise that sustainable health requires effort. Osbourne's candor stripped away the mystique, revealing that the waif-like silhouettes suddenly dominating the tabloids were not necessarily the result of iron will or superior genetics, but of a pharmaceutical intervention. Tracy Morgan followed suit, crediting the drug for his own dramatic slimming. His admission carried a different weight, given his public history of health struggles. Yet, the most telling validation of the drug's cultural ascendancy came from Elon Musk. When asked on Twitter how he had shed the weight, Musk replied with a succinct trio of factors. Fasting, Wegovy and Wegovy, is the generic name for Ozempic's higher-dose counterpart, specifically FDA-approved for weight management. With a single tweet, Musk brought the drug from the pages of medical journals into the feeds of millions, transforming a prescription medication into a viral commodity. The Musk effect on supply chains is well documented, and in this case, it contributed to a surge in demand that the pharmaceutical industry was ill-prepared to meet. As the confessions mounted, the cultural fissure deepened. While some flaunted their results with the casual air of showing off a new accessory, others recoiled at the implications of this chemical shortcut. Kate Winslet, an actress who has long navigated the pressures of Hollywood regarding body image, voiced a stark and sobering concern. She stated she found it terrifying how many people were turning to medical intervention for weight management. Winslet's fear highlights a growing anxiety, the medicalization of vanity, and the potential normalization of using powerful, systemic drugs to solve aesthetic problems. Her critique cuts to the heart of the dilemma. When a medication designed for a serious metabolic condition is used as a quick fix for cosmetic reasons, the medical risks are often ignored in favor of the visual reward. The physical toll of this easy weight loss is visible and often harsh, contradicting the narrative of effortless beauty. Dermatologists and plastic surgeons began reporting a surge in patients seeking treatment for what the internet quickly dubbed Ozempic Face. The condition is not a medical diagnosis, but a descriptive term for the gaunt, aged appearance resulting from rapid volume loss in the face. When the body sheds pounds quickly, it does not distinguish between necessary fat and the fat pads that cushion the cheeks and temples. These pads deflate, leading to sagging skin, deepened nasolabial folds, and a look of premature aging. Patients arrive in doctors' offices looking thinner but arguably older, their faces hollowed out by the speed of their own transformation. The skin, which cannot retract as fast as the fat disappears, hangs loosely, was creating a paradox where the pursuit of a youthful physique results in a face that looks drawn and exhausted. Khloe Kardashian, a figure perennially under the microscope regarding her physical changes, faced intense speculation regarding her own significantly slimmer appearance. While she has publicly denied using Ozempic, attributing her weight loss to rigorous gym sessions and diet, the timeline and the visual evidence fueled the rumor mill. The speculation forced public denials, but the pattern became undeniable. The era of the celebrity secret was over, replaced by an era of pharmaceutical transparency, or at least pharmaceutical suspicion. The uniformity of the new aesthetic, a specific type of lean, almost powerful look, bore the hallmark of a drug effect rather than the varied results of different diets and exercise regimens. Beyond the aesthetic concerns lies a grim logistical reality that turned the Hollywood trend into a public health crisis. The viral popularity of Ozempic triggered a global shortage, leaving actual diabetics scrambling to find their life-saving medication. Patients who had relied on the drug for years to manage their blood sugar levels found themselves facing empty pharmacy shelves. The disparity between the two user groups became a source of deep anger and resentment. On one side were individuals seeking to drop a dress size for an event or a photo shoot. On the other were individuals risking diabetic ketoacidosis or severe blood sugar spikes because their maintenance medication had been diverted to the weight loss market. The situation created a moral quagmire where the desires of the wealthy directly impacted the survival of the sick. The shortage was not merely an inconvenience, but a dangerous disruption of care. Type 1 diabetics who do not produce insulin and type 2 diabetics who struggle with insulin resistance found themselves forced to switch to less effective alternatives or ration their remaining supplies. Social media platforms, which had fueled the demand, became a battleground. Diabetics vented their frustration, sharing stories of driving to multiple pharmacies only to be told there was no stock. The narrative of the Hollywood secret soured rapidly as the human cost of the trend became impossible to ignore. The drug does not discriminate in its mechanism, but its availability certainly did, prioritizing those with the means to pay out of pocket or find sympathetic doctors over those with a genuine medical necessity. The personal accounts from users of the drug for weight loss paint a picture of a relationship with food that borders on the traumatic, an aspect often glossed over in the celebrity testimonials. While the weight loss is framed as a victory, the daily experience of being on the drug can be a grueling ordeal. One user profiled in The Guardian described a deep sense of loss, mourning the simple joy of eating. The nausea can be debilitating, a constant low-grade seasickness that makes the thought of food repulsive. This is not a matter of willpower. The drug hijacks the body's reward system, making the act of consuming sustenance feel like a chore rather than a pleasure. This food noise cancellation is often touted as a benefit by proponents of the drug, yet for many, it results in a hollow existence where the social and emotional connections tied to dining are severed. Users described how food, once a source of comfort and joy, became repulsive. The appetite suppression is so absolute that users often forget to eat for entire days, surviving on minimal calories without feeling hunger pangs. This dissociation from one's own biological needs is disorienting. The experience of eating a favorite meal and feeling nothing but revulsion is a psychological side effect that rarely makes it into the glossy magazine profiles of dramatic transformations. It is a form of chemical-induced anorexia, where the natural drive to sustain oneself is pharmacologically silenced. The psychological impact extends to the cessation of the drug as well. When users stop taking the injections, the appetite returns with a vengeance, often accompanied by a slower metabolism that has adjusted to the lower caloric intake. This phenomenon, known as the rebound effect, has been documented by influencers like Remy Bader. Bader revealed that after stopping the use of the drug, she binged and gained back the weight she had lost, plus more. Her admission highlighted a critical flaw in using the drug as a quick fix. Without behavioral changes, the underlying issues with food remain, merely suppressed by the chemical. Once the suppression is lifted, the pendulum swings back aggressively. This cycle of loss and regain can be more damaging to the body and psyche than maintaining a stable, higher weight. Novo Nordisk, the pharmaceutical giant behind Ozempic and Wegovy, finds itself at the center of a storm it never anticipated, but is financially capitalizing on in a historic fashion. The company's market value has skyrocketed, turning it into Europe's most valuable company, surpassing even luxury goods giants like LVMH. The demand has outstripped supply chains to such a degree that the company has struggled to ramp up manufacturing fast enough, despite investing billions in new production facilities. The gold rush era of branded weight loss jabs is in full swing, with analysts predicting that the market for obesity drugs could eventually reach $100 billion annually. This financial windfall is built on the backs of both the legitimate medical need for obesity treatment and the explosive, off-label demand for cosmetic thinning. The scramble to meet demand has turned the supply chain into a high-stakes logistical puzzle. The active ingredient in semaglutide is complex to synthesize, and the fill-and-finish process for the injector pens requires specialized machinery. Novo Nordisk has had to ration supplies to the US market, prioritizing lower-dose pens for new starters to ensure existing patients are not left stranded. This rationing, however, has led to price gouging and the emergence of a black market. Prescriptions are being sold off-label, and unregulated products are circulating through gray channels, often with dubious efficacy and safety profiles. The desperation to obtain the drug has eroded the safety barriers that typically govern prescription medication. However, this dominance is not destined to last indefinitely. The industry is bracing for a seismic shift that could upend the current market dynamics. As patents on the core formulations approach expiration, competitors and generic manufacturers are circling like sharks. Bloomberg reports that the market is preparing for an influx of cheaper, generic alternatives that will shatter Novo Nordisk's monopoly. Companies like Pfizer and Amgen are racing to develop their own versions of GLP-1 agonists, some in pill form rather than injections, which could further democratize access. The arrival of generics is expected to drastically lower the cost barrier, making these drugs accessible to a much wider demographic. The looming competition represents a threat to Novo Nordisk's stock market supremacy, but a potential victory for accessibility. Currently, the high cost of the drug, often exceeding $1,000 a month without insurance, restricts its use to the wealthy or the well-insured. The entry of generic competitors could drive prices down significantly, turning a celebrity indulgence into a standard medical intervention for the general population. This shift forces society to confront uncomfortable questions. If a safe and effective weight loss drug becomes cheap and widely available, does it become unethical not to treat obesity? Or does the widespread use of such drugs signal the end of the body positivity movement and the triumph of a single, chemically induced aesthetic standard? The democratization of such a powerful drug presents a complex and worrying future. As prices drop and availability increases, the ethical questions surrounding the cosmetic use of diabetes medication will only intensify. We are moving toward a world where extreme weight loss is a prescription away, removing the struggle from the equation, but also the journey. The mystery of the Hollywood Shrinking Act has been solved, but the long-term consequences of this pharmaceutical interference with human biology are just beginning to unfold. The suspense lies not in whether the drugs will remain available, but in how the human body and society will adapt to a reality where the fundamental urge to eat can be turned off with a weekly injection. Not everyone in Hollywood viewed the miracle drug as a blessing. A significant faction of the entertainment industry began to push back against the narrative, raising alarms about the physical, ethical, and societal costs of the trend. Raven-Simonet brought the conversation back to medical necessity, emphasizing the distinct line between treating a disease and chasing a silhouette. Speaking on her family's history of prediabetes, she argued that diverting medication for glamazon purposes is a dangerous gamble. Her stance was pragmatic: do what you must, but ensure the drugs remain available for those whose lives depend on them. Oprah Winfrey found herself navigating a complex minefield of public opinion and business interests. Initially, she framed the use of such drugs as the easy way out, a sentiment that clashed with the ethos of diet culture she had long championed. Her comments at the Life You Want class carried the weight of someone who had spent decades in the public eye scrutinized for her size. Yet, this narrative became complicated by her stake in Weight Watchers, which had just paid over $100 million for a telehealth service prescribing these very medications. The market reacted swiftly to her hesitation. Weight Watchers stock dropped 15% after her easy way out remark. Winfrey quickly pivoted, clarifying in the Wall Street Journal that prescription drugs are a viable option for those struggling with health issues, though the whiplash between her initial skepticism and eventual acceptance highlighted the fraught nature of the debate. Amy Schumer offered a visceral rebuttal to the drug's polished image, recounting her own trial with semaglutide as a physical nightmare. She described feeling violently ill to the point where she could not interact with her son, too weak to play catch while wasting away. Her critique extended beyond the side effects to the culture of dishonesty surrounding the trend. Schumer called out the hypocrisy of celebrities, attributing their rapid transformations to smaller portions, demanding transparency in an industry built on illusion. She noted that when she underwent liposuction, she owned it, and she expected the same honesty regarding the weight loss injections. The visual saturation of the drug also drew rage. Sophie Turner reacted with blunt hostility to the marketing blitz taking over New York City. Reposting an image of subway station adverts, she dismissed the aggressive campaign with a sharp WTF, signaling that for many, the commercialization of a medical crisis had crossed a line. Padma Lakshmi approached the issue from a sociological angle, noting the disproportionate pressure placed on women in media. She acknowledged the temptation to succumb to the trend, but argued that the solution lies in addressing the deeper inequities of the industry rather than medicating the symptoms. When speculation turned toward Julia Fox, the actress shut down the rumors with a flat denial. She maintained that she would never touch the medication, explicitly citing the shortage faced by diabetics as the moral barrier. Jamila Jamil went further, characterizing the trend as a dangerous craze fueled by deep-seated prejudice. She warned that the purchase of these drugs by the wealthy for vanity purposes, paying upwards of $1,000 a month, was actively harming actual patients. Her indictment was scathing. "Fat phobia has our generation in a chokehold," she wrote, predicting a future where the health consequences of this casual misuse would become undeniable. The normalization of these drugs signals a cultural shift toward viewing obesity not as a lifestyle failure, but as a biological flaw to be corrected medically. While this reduces stigma for those who struggle with weight, it also pathologizes a larger portion of the population. The line between treating a disease and enhancing the healthy is becoming increasingly blurred. If Ozempic becomes the aspirin of the 21st century, taken preventatively by millions to ward off weight gain, the pharmaceutical industry will have achieved its ultimate goal, medicalizing the human condition. The implications for the food industry, the fashion industry, and the collective psyche are profound. We stand on the precipice of a new era where the body is malleable in ways previously unimaginable, governed not by will, but by the supply chain. Furthermore, the long-term health effects of using semaglutide for decades remain unknown. While clinical trials have shown relative safety over a few years, the data on lifelong usage for non-diabetics simply does not exist yet. Potential risks include thyroid C-cell tumors, a warning carried on the drug's label based on animal studies, as well as pancreatitis and gallbladder disease. The current wave of users is effectively participants in a massive, uncontrolled global experiment. The allure of the quick fix often overshadows these potential long-term costs, particularly when the immediate gratification of weight loss is so tangible and socially rewarded. The narrative of Ozempic is a classic tale of unintended consequences. A drug designed to help those suffering from a chronic metabolic disease became a vanity project for the rich, sparking a shortage that endangered the lives of the vulnerable. It exposed the deep-seated desperation of a culture obsessed with thinness at any cost. The celebrity confessions provided the initial spark, but the fuel was the age-old human desire for a shortcut. The mystery of how the stars stayed thin has been replaced by the stark reality of a world where the solution comes in a pre-filled pen. As the market braces for the influx of generics and the inevitable commoditization of this miracle drug, one thing is certain: the relationship between humanity, food, and medicine has been irrevocably altered. The curtain has been pulled back, and the wizard is a vial of clear liquid, promising to silence the hunger, but perhaps also the soul. That's it for today. Thanks for watching. Leave a like and subscribe to the channel. See you in the next one. Until then, goodbye and good night.